So our next patient is a very pleasant 52-year-old woman who had her nose done a few weeks ago, and so we're going to go see how she's doing. So here we go. So she's a few weeks out. How long has it been since your surgery?
3 weeks on Thursday.
3 weeks. So it's still very early, but so what's your reaction so far?
Very happy. Beyond.
That's great. So
The best.
thank you. So we don't usually take pictures this early, but we're going to take a set of pictures just so that we can look at the initial changes that we made. So we're going to get a full set of pictures now. Okay. She's got to get on a plane, so we're going to be fast, right? Okay, good. So the goal of her surgery was to give her a more subtle, prettier version of what she already had. She didn't want to look different. She just wanted a more elegant version. And I think we achieved that. I think this fits her face very well. It's very pretty, soft. Now it's early. Put your head back. It's still very early, but I like the changes that I see.
Both my boys didn't notice.
So now typically we'll follow people for a year. Turn this way for me. Because that's, for academic honesty, we like to look at the before pictures and 1 year out. But that's not to say that you can't see positive change even after a few weeks. So we're going to go in the other room. We're going to put the pictures on, and we're just going to look a little bit at your before and afters. Patients often ask, what's the recovery going to be like? So we have a very nice woman who just had her nose done a few weeks ago. So maybe you could tell us what the experience was like.
It was actually very easy, much more, it was really, other than feeling like I had a cold, which I don't have, that was about it, just swelling, bruising, no pain.
Did you have any apprehensions kind of going into it
I try not to think about it. Therefore I wouldn't be fearing anything, so I just kind of went into it knowing that it was going to be better than what I had before, and I knew I was going to recover fast. And that's what happened.
So are you happy you did it?
100%.
That's great. So her surgery went really well, and really I tell people that it's really a week, right? It's a few days of being uncomfortable. It's a few days of hiding out. But after a week, when the cast comes off and the sutures come out, you start to feel like yourself again. I think that first shower on day 6 or 7 is when you really feel like yourself again. To me, doing a good rhinoplasty involves giving the patient what they want, and often it's the subtle changes, especially in my practice. People know exactly what they want, and subtle rhinoplasty is harder than the dramatic rhinoplasty. I mean, you can take off bumps, but when you're really trying to create a nose that's pretty, elegant, exactly what they want, that requires more skill.
And something that looks like your own and not somebody else's.
Yeah. So, people will say, like, what kind of nose do you make? And I say, well, whatever they want. And so every rhinoplasty that I do is different. You never do it twice the same way. I mean, there's certain patterns that you see in rhinoplasty, but for the most part, you're creating a unique nose for that person. This is her pre-op picture. So one of the goals was to take down the bridge a little bit, was to bring the tip of the nose up and back. So the goal of the surgery was to create a smooth bridge on profile, to take the tip, which is a little bit down, and bring it ever so gently up and a little bit back. To make her nose, she's a very pretty lady, and we wanted to make the nose a little more elegant. So here, once again, a little bit full in the bridge, and the tip is a little bit what we call dependent, where it's down and a little bit too far forward. So what the goal was, bring the nose up, bring it back, and make the bridge smooth. So now this is early, so she's still swollen, but we can get a sense of the change. And here she is after just a few weeks, okay? And this is not a morph, this is her actual picture just a few weeks after the surgery. And I think we've accomplished those goals. So you can see that the bridge is straight, a little bit of fullness, which is very natural and pretty and really fits her face. The tip is ever so gently closer to her face, and it's been ever so gently rotated. So to me, this is a very pretty, elegant nose that fits her face. And this doesn't look like a rhinoplasty. The bridge is elegant, it's full, the tip is in the perfect position. Plastic surgeons like to measure angles. If we measure this angle, it is an ideal angle for her, probably about 105 degrees. But more importantly, the nose is pretty. And if you look at this nose, you say, this is a pretty nose. It doesn't look like she had surgery. So here she is before, and once again, she's very pretty. And she has a little bit of fullness in the bridge. The tip is a little bit down, and her nose is still just a little bit over projecting. So the goal, once again, bring the tip up, bring it back, and make the dorsum blend with the tip a little bit nicer. So here she is before her surgery. And a lot of times we're seen straight on sometimes from the side, but often we're seen at these angles. So this picture is very important. So now we're going to look at her post-op today. And here she is, the same view. And once again, this is only a few weeks out, so it's going to become more refined. It's going to become more subtle as the swelling goes down, but the bridge is straight. The tip has been reshaped subtly, a little bit. The tip has been brought back and up. So what we do with the rhinoplasty is we want to keep the elements that we like in the nose, and we want to modify subtly the other things. So my goal was to soften the bridge, soften the tip, reposition the tip by bringing it up and back. And if she looks this good after a few weeks, she's going to look amazing in 6 months or a year. So you don't necessarily have to wait a year to have a nice result. Okay.
Was this something you had probably put a lot of consideration into? Do I
I've been
really
thinking
want
about
to
it
do
since
this?
I was a teenager. I'm
Really?
52. Yeah.
And and I get we get a lot of that. We get a lot of people that say like, "Oh, I wish I had done this, when I was a teenager. I wish I had done it 20 years ago." It's always a good time,
I'm afraid.
right?
Afraid of having a fake looking nose.
Yeah.
That was the reason, not the surgery. Afraid of not looking like me.
Mm-hmm.
And so what we want is, so it's very important that people maintain their identity. I mean, sometimes people want radical change, and we can do that. We can certainly make your nose very different. Okay. All right. So here she is before. Now, I've said this 3 times now. Very pretty. She has some subtle things that I would improve on the nose. If you notice here, it's a little bit wide up here and a little bit pinched in the mid portion of the nose, and the nose is a little bit crooked. The nose tends to move a little bit from left to right, okay? And the tip is a little bit fuller than I would like. So now the frontal pictures, especially early on, will be a little bit more swollen. This is the pictures that will look best 6 weeks, 9 months, a year later, as opposed to where we are now. But we're going to look at even the changes from the front, which are the hardest really to improve early on. But if you look here now, okay, and she's still very swollen, what she has is she has a much more balanced nose. So one of the things that plastic surgeons talk about are called dorsal aesthetic lines. So if you imagine a line that goes from the brow to the edge of the nose and down to the tip, it should be nice and soft, okay? And so the width of her nose is more desirable. So we've narrowed the bones a little bit, we've widened the central portion a little bit, and then we've maintained the proper size of the tip. So when you look at her from the front, the eyebrows blend with the edge of the nose here, and those dorsal aesthetic lines are nice and pretty. So you don't have to know these terms. When you look at this nose, it just looks pretty. It looks natural, it looks soft, doesn't look done. And so when we go back, and I'll take you back and we'll look at the pre-ops again, but you can see this is the appropriate width, this is the appropriate width, and this is the appropriate width, and the tip is in a better position. So now if we go back and look at her pre-op pictures,
And you don't have any pain or discomfort now?
No, it just
Just a
feels
little.
funny.
Okay.
It's not pain. No.
Yeah.
okay, so here she
I
is.
really never had pain.
So here she is on the pre-op view. This is a little bit wide, this is a little bit narrow, this is a little bit twisted, and the tip, it doesn't have the same shape as her post-op views, and it's a little bit dependent. So the frontal view is the hardest to change. It's easier to change the profile, but to get a beautiful nose right from the frontal view, when you look straight at the person, that's the real judge of a rhinoplasty. Here she is, as I said. And this is just a few weeks out, but it's really pretty. The nose is straight. The width of the nose in the top portion, the middle portion, and the bottom portion of the nose is well proportioned, and it fits with the tip. So all in all, I think she looks great. Now the other thing is there's nothing to do. So if the rhinoplasty goes well, which it did, and you take out the stitches and you take out the splints and you remove the cast, you take a shower, and that's it. And I like to see people back because I enjoy seeing how people progress. But the truth is that she could come back in a year and I can get her picture.